Welcome everyone to the second webinar on maintaining stroke as a priority. It's 11 a.m. in Melbourne, Australia and 9 a.m. in Singapore. I'm Carmen Lake-Jenkins, Managing Editor of the International Journal of Stroke and Project Manager for the World Stroke Academy. If you're on Twitter, our hashtags are @WorldStrokeOrg and IntJStroke. This session runs for an hour and will be recorded and hosted on the World Stroke Organisation website and our YouTube channel. After this presentation with Sharon McGowan from the Stroke Foundation Australia, Deirdre De Silva from the Singapore National Stroke Foundation and Emma G, a stroke survivor, we will have a Q&A hosted by Sharon McGowan. If you want to add to the Q&A, please do so using the Q&A function, not the chat function. And please do add your questions during the talk rather than all at once. So we're going to start first with Emma G, who is an inspirational, one of Australia's acclaimed inspirational speakers, offering her thoughts and solutions on person-centered care and resilience through her keynote presentations, workshops and consultancy. With a background in occupational therapy and as a stroke survivor, Emma is a renowned expert and a living example of what it takes to step in another's shoes and truly bounce back in life. Through her inspiring presentations, Emma is able to both captivate and challenge her audiences to consider what is possible in their own lives. Learning to speak again post-stroke and realising the importance of sharing her story to help others were the catalyst for Emma taking on speaking professionally. Today, and thousands of presentations later, Emma is an inspirational speaker, has an incredibly broad client group from healthcare associations, hospitals and rehabilitation facilities, businesses and corporate events, community organisations, through to educational facilities. She has also just published her first book entitled Reinventing Emma. Emma is passionate about enhancing person-centred stroke delivery and resilience in the lives of all she works with, and promises to leave her audiences inspired to bounce back and step up. So Emma, I'll get you to share your slides as you're our first presenter today. And when you're ready.
Thank you. This is me about 10 days after brain surgery, where I had unexpectedly had a stroke at the age of 24 during a procedure and went into a coma. And I was actually in the stage at the danger zone of ICU. I can't move, I can't blink, I can't communicate, I can't walk. I'm very much paralysed by fear, beyond terrified. I feel robbed, locked in and dependent. And you know, these are very much the feelings that I feel now as a stroke survivor in the COVID times. I'm going to get back to those feelings a bit later, but I really want to focus on my lived experience as a stroke survivor in this pandemic, and the rehab and community participation element, which is so important in ongoing stroke care. So I'll quickly relate my story in that to really highlight the importance of someone's stroke recovery and being mindful of that, really focusing on again on the pandemic and then going to questions at the end if we need to do that. So as 15 years ago, I had a stroke and I was a full-time therapist and went into a coma, and then had to go through rehabilitation and basically receive the care that I provided. So I began a recipient of that care. And it was very traumatic for me, both physically and emotionally, and really highlighted me the importance of putting everything again and the huge impact that had on not only me but all those around me. a really, really terrifying time for me. Feeling so isolated, and definitely the reason I'm highlighting this video with you all is to really show the importance of that many commonalities that I'm experiencing now in this COVID realm as a stroke survivor. The difficulty with access, the lack of support and ability to access that support, huge reliance on others to do things. And I know after months and in fact now years of rehabilitation, I have actually thought, I guess it was a bit of hope, but also denial as well, that I would return to my old life prior to my stroke as a full-time therapist and live independently again. And I was naively, even though I'd lived the care in that stroke realm, was unaware of the huge impact that this integration to life would have on me. Going out into my old world in a new body and unable to do anything the same ever again. Very isolating times for me. And I had a lot of invisible, along with my physical limitations of being in a walking frame and being unable to speak or blink. The invisible issues that over the years I've managed, like pain and huge visual issues that have been underlying in my recovery. And I thought things were great, but then COVID came along and added to the ongoing challenges that I do endure and many others do endure. And the physical and emotional toll that COVID has had on me has been phenomenal. And I think I felt that having mastered in a way and worked out strategies to overcome my pain and learn to swim again and do yoga to manage my pain, and ensure that, yeah, I could get back to work, and not as a full-time therapist, but I really like to speak, as was mentioned before, to really to unleash what was dominant in my inside, and suddenly I couldn't travel to do that. COVID put a huge restriction on that. So for me, it was a really isolating time. Like I really struggled with that. I suddenly had to move back home and be reliant and a burden on people. And whereas I live independently in Melbourne now, and through the NDIS was able to have an amazing support network and not rely on my informal support as much, suddenly I couldn't do that. And my ability to travel and work and share my insights as a patient and as a therapist and undertake all the volunteer work that I love to do, like with organisations such as the Stroke Foundation, I wasn't able to do anymore. But in fact, I've actually commenced working, like all of us, in online capacity, and so I'm presenting, like today, virtually, which is one way which I can continue, hopefully, to share that. But also the rehab for me during COVID has been really difficult. In fact, in 14 years into my recovery, I decided that I would learn to run to both improve my own outcomes, but also hopefully advocate for others and show them that things are possible. And so I've been going to Epworth twice a week and swimming and doing yoga to manage my pain. But during COVID, I couldn't do that. you know, my ability to do rehab has been compromised. And I've had to go and buy an exercise bike to manage my pain. I do online yoga, but I can't do that. And I've actually commenced running in my local park and got my physio at rehab to come join me to try and sustain my progression in trying to run again. And it's really difficult, and I think it's a huge prevalent issue that a lot of people don't have access to the needs and feel like they're going backwards. And then there's therapy in COVID, which is really, again, really difficult to access and so isolating to not have that support. And very much the emotional aspects, the invisible aspects that you can't see, that I think have really, really challenged me at this time, whereas I'm able to intrinsically motivate myself to do things like yoga and running, but I think it's important to weave in that emotional outlet. And so I speak to my psychologist every few months through telehealth, which is a great thing for me. Also, seeing my ophthalmologist as I've had difficulties with my eyes with all the screen time, which I'm sure everyone has, and that's via telehealth. Again, Botox is something that I use to smooch my face, but that is something that during COVID I cannot do, and so therefore it's really meant that my speech, my swallowing, my ability to present and to articulate, my facial pain, everything is a lot worse because I do not have access to that normal therapy. And again, I think the huge importance of support and connection is so crucial during COVID to maintain, I think, a lot of particularly the emotional mental health of people going through trauma. It is COVID a second wave, I guess, of trauma for many of us survivors. So that connection is vital. And I know for me, I can't do what I did, and I had such an amazing support network. But now I try and do other things at a physical distance. So, and my parents are amazing at that, and my nieces and nephews. Also ensuring that I have an outlet and that is facilitated by others in my support network. So whether it's speaking with friends or walking my dog or doing yoga or making my isolation quilt, those things are really important to have that time out from all the therapy hours and demands and pressures and the hidden anxieties that exist at this time. So thinking about stroke rehabilitation community participation and how vital that is on the stroke recovery. You know, back to this photo I showed at the start. So I've had a stroke and I'm paralysed on the ward and feeling so robbed and locked in and dependent. And, you know, this is exactly how I feel as a stroke survivor in COVID-19. I know definitely that I'm not alone in this. But whilst this is such an unprecedented time for many, the importance of good access, a great support network and that connection, and the ability to adapt our lives and better manage each person's physical and emotional needs is so crucial. I know personally that being mindful of these makes what I endure as a stroke survivor easier to withstand. So whether it's improving support and treatment or advocating for those that can't, it's really important at this time during COVID that we can definitely ensure that. So let's choose to unlock possibilities and improve access to stroke care, support and treatment lessen the burdens and create possibilities. Thank you.
Thank you so much, Emma. If you could unshare your screen and then we'll move on. Just a reminder to everyone that don't forget to add your questions to the Q&A function during the talk. This webinar is hosted by the World Stroke Organisation and Stroke Connectors. Sharon McGowan was appointed as Chief Executive Officer at the Stroke Foundation in February 2016, a national stroke support organisation working in stroke prevention, quality improvement, guideline development, post-stroke support and research. She originally trained as a nurse, and Sharon has worked in Australia and the UK with a range of government statutory authorities and not-for-profit organisations in management roles focused on community engagement, culture transformation, health promotion, fundraising and voluntary service. Sharon holds a Masters of Business Administration from Cranfield University and is a graduate of the Australian Institute of Company Directors. Her current roles include board member of the World Stroke Organisation, co-chair of the WSO Stroke Support Organisation Committee, co-chair of the Australian Stroke Coalition and chair of the Australian Chronic Disease Prevention Alliance. Acutely aware of the devastating impact that stroke can have on survivors and their families, Sharon is committed to improving the understanding of stroke and championing bipartisan support for it as a major health priority. As CEO of Stroke Foundation, the voice of stroke in Australia, she is passionate about bringing government, health professionals, researchers and the broader community together to fight this terrible disease and drive system change. Go ahead, please, Sharon.
Thank you so much for that wonderful introduction, Carmen, and thank you to Emma for just an extraordinary presentation again. And I really loved your ending challenge to us all to unlock possibilities. I think that's a fantastic way to start this presentation and to share what the Stroke Foundation and the team here in Australia have been doing to try and connect and ensure we have community participation to improve stroke care during a time of COVID. So the picture you see on your screen there is our wonderful Shannon Nelson, who's another of our stroke ambassadors, a young stroke survivor, a mother of two, and very similar to Emma. She is a healthcare professional by background and has an extraordinary stroke story to share, and has been on a recovery journey and sharing that with us through her own experience and how she's dealt with her recovery. Very similar to Emma, a very resilient lady and an amazing family support network. So I thought I would give you some context about stroke in Australia. For our international audience, Australia is a very large country. We have about 25 million in our population, but we have an extraordinarily large landmass. We're about 50% bigger than Europe. We're a huge number. We're about 32 times greater in terms of our landmass than the UK, and we're almost the same size as the United States. So it's a very big landmass, but only 25 million people. So we are dispersed around this country. As Carmen mentioned in her introduction, stroke is a major health priority in this country, but hasn't often been recognised as that. So we're on a major mission to make sure that it is recognised and supported as a major health priority. It is still this country's third biggest killer, and we estimate there will be about 56,000 new and recurrent strokes in this country every year. So that's 1 every 9 minutes. And if we don't improve our systems of care and our prevention of avoidable stroke, then we estimate that by 2050, there'll be a stroke every 4 minutes, which I think would be a devastating outcome for everybody. Our system over the last 20 years has improved. We've made significant steps forward. We're on a journey of improvement. We haven't reached our destination yet, but we are on this journey. And during that time, we have significantly improved mortality from stroke. As a result, we have a lot of people who are now living with stroke. Emma's an excellent example of somebody who is living with stroke and continues to recover and adapt over many years to come. So 30% of our stroke survivors are under 65, and as Emma, are reinventing themselves and their careers to continue to be productive members of our workforce, and often in very different career pathways. So 475,000 Australians are now living with stroke. So that is a very big community that could be impacted by COVID-19. I did mention that Australia is a very large landmass, and we have an overrepresentation of stroke in our regional areas. So it's like a double barrier. We have regional Australians who have poorer access to emergency stroke services, and they have a higher propensity or higher risk of having an avoidable stroke. So one of the focuses of us is how we can actually maximize and essentially unlock possibilities, to quote Emma, around technology to support our people in regional Australia. One, in terms of the messages around how we can prevent stroke, but also in terms of creating effective pathways. So Australians living in regional, rural and remote areas can actually access emergency stroke care. So during COVID-19, just to put it into some perspective, Australia has managed the COVID outbreak exceptionally well in terms of the global numbers. So we have just under 8,000 confirmed cases in this country and 104 deaths. But we have done that because of the social restrictions, the social distancing, the lockdown measures that were put in very quickly, commencing in March. So although we've controlled the numbers incredibly well by comparison to other countries, the impact of those restrictions, the isolation, the lack of access to routine care has impacted our stroke community. And obviously this being the main topic, in fact, I think for months it was the only topic on all of this sort of 24-hour news cycle, it means that it was creating a lot of anxiety and fear in the community. So the Stroke Foundation runs a stroke helpline that is staffed by qualified health professionals, physiotherapists, occupational therapists, speech pathologists. And 6% of our inquiries during this time, during the last few months, have been specifically COVID related. So during that time, on average, we have about 3,500 calls into our stroke line. We haven't seen a significant increase in our call volume, but this type of calls has definitely shifted towards a COVID interest, but also concerns and worry about isolation due to COVID restrictions. So there may not have been questions specifically related to COVID, that was 6% of our calls, but overall, the calls have been very reflective of a community that is anxious and worried and restricted through those isolations. So very much reflecting some of the feelings and emotions that Emma shared with you. Our community engagement council in events during this time were also cancelled, and all of our volunteer programs were suspended as an organisation. So one of the key programs that we run is actually community education, and we have about 350 volunteers that actually assist us in the community with community talks. And we also provide resources to stroke support groups around the country and work with stroke associations around the country to ensure that they have evidence-based resources. Now, all of those, due to social isolation and social distancing and the associated isolation, all of those programs were suspended during this time and continue to be suspended in many parts of this country. So there was definitely a need to get out to the community more information about staying well and keeping connected. We also acknowledge that there was a significant gap, as Emma mentioned, in terms of access to rehabilitation during this time. So we, in the initial period when these lockdown measures came into place, we gathered all of our researchers from around the country and we asked them what we could do to really improve access to rehabilitation and support for our stroke survivor community during this time. One of those things that we did was to establish a dedicated hub on our website, which is the Stroke Foundation's Inform Me platform. This is a dedicated platform for health professionals, and all of our researchers from around the country gathered evidence-based telehealth information and placed it on a dedicated hub. That hub has been incredibly successful with our health professionals. We have about 15,000 health professionals that are registered on our Inform Me site, where they can get access to the stroke guidelines and to stroke-related data, and now to a dedicated hub with telehealth resources specifically for stroke. And as Emma mentioned, a lot of our primary care and our rehabilitation is now being managed by telehealth. During this time as an organisation, we also reached out to government to make sure that allied health professionals could access the relevant items through our Medicare benefit schedule, which is how we reimburse our allied health professionals in order to deliver telehealth supported services to stroke survivors during this time. So that was a new initiative that came into place over the last couple of months to make sure that the clinical pathways that could be available in terms of supporting people with rehabilitation were available. So telehealth and telehealth rehabilitation services are our top 5 search items at the moment. And many people will be very familiar with this, what we call the chain of survival for stroke. So stroke relies on community awareness of the symptoms of stroke, relies on early dispatch of emergency services or ambulance services, early transport to appropriate hospitals that are capable of treating stroke, and early treatment, and then early rehabilitation. So it's very much a chain, and each one of those links need to work seamlessly together to enable stroke survivors to have the best outcome and the best life possible after stroke. What we saw during this time was there were definitely delays or people not actually calling ambulances, particularly for minor stroke symptoms, transient ischemic attacks. We had early discharge of patients, hospitals very keen to have patients who were non-COVID discharged as soon as possible, and subsequent isolation. The solutions we put into place was to increase our fast signs of stroke education in the community. We did radio, we did television, we got influential people from the country, including the country's Governor General, to actually record video messages supporting the stroke signs of stroke fast message. We also, as I talked about, encouraged the government to extend the Medicare benefit scheme to include all allied health staff so that they could deliver telehealth rehabilitation, and created the telehealth hub. We connected to the community. We have a very active social media function and a very active community, and we encourage some of our stroke advocates to be very vocal on social media, through blogs, through poetry, through song, through all ways of trying to keep our community together. So we have about 66,000 followers and members through various online social media platforms: Instagram, Twitter, LinkedIn, Enable Me, which is our dedicated consumer platform, which has evidence-based stroke podcasts and evidence-based stroke resources that can be accessed. So connecting our community was really important. We've also created a new stroke outreach program, again via telehealth. But just to give you some indication, we had this post on stroke during this time, and this Facebook post on COVID-related risk reached 18,000 plus people, attracted over 500 reactions, and was shared over 2,000 times. So it's really important that we got those messages out and people were really responding to that. We also just finally encouraged our stroke survivors to share the FAST message, and I would like to share that video with you now.
I'm Eve. Dad had his stroke a few months before I was born. He got to hospital quickly so I get to have a dad. Know the signs of stroke. Think fast. Get to hospital.
Hello, my name's Adrian. I've had a stroke. Stroke's always a medical emergency. Stroke doesn't stop for COVID-19. If you think you're having a stroke, act fast, get to hospital immediately, call an ambulance. Time equals brain. Thank you.
Hi all, my name's Ida and I'm a stroke survivor. My friends knew the signs of stroke, known as FAST, and once they noticed that I was having some symptoms, they notified emergency immediately, and this saved my life. So please know the signs of stroke, and if you think you're having one, contact 000 immediately. This could save your life, and the sooner the treatment, the better. Currently, with our current situation with the pandemic, You know, stroke does not stop for COVID-19. In actual fact, stroke does not stop for anything or anyone. So please keep safe and know the signs of stroke and act promptly.
My name is Nicole and I'm a stroke survivor. A stroke is always a medical emergency. If you suspect a stroke, call for an ambulance immediately.
My name's Tony Finner and I'm a stroke survivor. Stroke is always a medical emergency and stroke doesn't stop for COVID-19. Know the signs of a stroke, and if you suspect a stroke, think fast. Face, arms, speech and time, and then act fast. And call an ambulance immediately. The ambulance would prefer to be called than not called. If in doubt, act fast.
Hello everyone, my name's Sue and I'm a stroke survivor of 27 years. I'm here to share a poem with you to help everyone learn how to recognise the signs of a stroke. Are you someone who doesn't know that a stroke attacks the brain? Life goes on around us and it's never quite the same. Learn how to recognise the signs and then how to respond. F is my face drooping. A, my arms not level. S, speech slow or slurring. T, time to call 000. I'm a survivor, not a victim. I'm a person just like you. And when it comes to fighting stroke, I'm here to see it through. So please remember that a stroke is a medical emergency and how to recognise the fast signs.
Thank you all very much. And I'm looking forward to answering your questions and posing those to the panel.
Thank you so much, Sharon. That's wonderful. Okay, just a reminder that don't forget to add your questions to the Q&A. You can see that we've already got some on our way. And also, please don't forget to tweet. I see some people are out there already tweeting already, so that's great. Next in line, we've got Deirdre De Silva, who is a consultant neurologist at the and head of neurology at the Singapore General Hospital campus of the National Neuroscience Institute in Singapore. She's an associate professor with the Duke NUS Medical School, leads of the Singapore Ministry of Stroke Service Improvement Team, and a board member of the World Stroke Organisation, and a committee member of the local Singapore Stroke Support Organisation. Thanks, Deirdre. Please feel free to go ahead.
Right. So good morning from Singapore, and thank you for having me part of this webinar series. I really enjoyed the first two presentations. Thank you, Emma, for sharing your personal story. And Sharon, you know, it's surprising how many things we share in common as we face COVID. And I'd like to thank the World Stroke Organization for organizing this so that we can actually learn together and learn from each other and do a better job. So my name is Deirdre. I volunteer with the Singapore National Stroke Association and I help on the World Stroke Organization board. But my day job is as an acute stroke neurologist. So my task today really is to talk about stroke rehabilitation and what we're facing with COVID and how we can do better. I just thought that I'd remind us what rehabilitation is about, and it's to help facilitate people who are in a health state where they're likely to face disability and to help them attain optimal functioning in interaction with their environment. And while we focus a lot on physical issues, I think we really must consider the psychosocial and vocational benefits when we are thinking about rehabilitation, especially during this COVID period. It's a very broad and heterogeneous topic, but it's also very closely linked to reintegration, recovery, and support. And I think we must consider this as we're developing our plans for the COVID period and the post-COVID period. In terms of the benefits, you know, we often think about the obvious ones of improving morbidity, mortality, quality of life. But again, as we plan our COVID strategies, we should think of the less obvious benefits of rehabilitation, the interactions with other people, the opportunity to get out, the psychological care that comes with it. And for carers, the respite and support that rehab offers, the links that it allows to continue with the health system, and the screening and detection of complications. I thought I'd just look firstly at how we all view rehabilitation from different people. So as acute neurologist, I can be critical of how sometimes the acute doctors think. So we are thinking, there's a delayed transfer to rehabilitation. We're trying to get the patients out of the acute ward because we're concerned about infection control. But we do worry about the poorer functional status that patients may have to face as a result of limited rehabilitation and the higher potential for complications that we are known are associated with stroke and immobility. What about the therapists? So I asked some of my colleagues what they are facing, and they are concerned about having to manage patients while implementing distancing and cleaning rules. And how do we treat so many people now that everybody has to be treated really one-on-one without the group therapy being suitable during COVID? With tele-rehabilitation and videos, some people are concerned whether they're as effective and how do we make them more effective, and how do we ensure that safety is still primary during these tele-rehab and online videos. And with limited resources, I guess for therapists, they're thinking, how do I triage and prioritize patients? And from the psychosocial consideration, how do I develop and maintain therapeutic bonds if my communication is mainly online? But probably most importantly, and we heard this from Emma, is what are the perspectives from a stroke survivor? There's a lot of uncertainty. Healthcare workers often don't even know what are the changes, when things are going to get better. Stroke survivors have to face delays in appointments for rehabilitation and limited access. While they're in hospital, there's limited visiting, so caregivers, when they go home, are less prepared. You're going to have support from family who's nearby, but maybe not from further away because of distancing and visiting rules. There's little or less support from stroke support organizations, and this is another difficulty. There may be fear and anxiety to go outside for rehabilitation with stay-at-home advice. And again, with the stay-at-home advice, it's harder to integrate and to see friends and people who support you. And I put this down as a psychological double whammy. It's really hard, and we heard from Emma how it's very stressful and difficult to cope with stroke. And now people have to stroke with COVID and the stresses from that as well. And let's not forget the issues with job security. During COVID, many people have had issues with employment. There are less employment opportunities, and there are more financial difficulties compounded by the COVID situation. We did a very small survey in Singapore of stroke survivors and their family caregivers. We found that majority of them had their physical activities curtailed. And the main reason was the closure of outpatient and community centers. There was concern of the inability to exercise, and that would affect recovery. And without rehab, some caregivers observed that their loved ones' mobility was deteriorating, they were deconditioning, and they were needing more physical assistance. So I thought I'd just give you some examples from Singapore and look through the different settings, because really how COVID impacts us is in various different settings as a stroke survivor goes through their journey. So in the stroke wards, there's always concern about possible protection equipment and precautions. And so really the primary aim in the acute hospital is to assess the deficits, figure out what the needs are, and have good discharge planning. We try to avoid unnecessary repeated visits in the outpatient setting. We try to replicate this with telephone phone calls and provision of contacts if people need help, and to arrange appropriate rehabilitation, even if the appointment is pending because we're uncertain when it can be, but at least make that link so that we can re-link once things settle down. Other possibilities is, we know that we often meet multidisciplinarily, and if we can't do this face-to-face, that we can do it alternatively with Zoom. And another suggestion is that to start the tele-rehab and videos while the patient is in hospital, so they build familiarity and it's not so strange when they go home. For inpatient rehabilitation, my colleagues tell me that the group therapy has had to stop and it now moves to individual therapy. And this puts a pressure on manpower, and as a result often translates to shorter therapy time. There are concerns that we need to maintain distancing in gyms and to have adequate cleaning. One project which I think really helps, and this was developed by a colleague, physiotherapist Shamala, is the ARISE program, where this was actually developed before COVID, but for two times a day for 15 minutes, music gets played in the ward, and patients do exercises in their bed or next to their bed on their own. So it's really self-directed. So these exercises would have been taught to them by their therapist and at least give some extra time during these difficult periods where there's limited rehabilitation. In the outpatient setting, at least in the hospital that I work at, tele-rehab was started very quickly, and the use of videos is often used to help. We're really trying to mix this together with hybrid face-to-face sessions so that we also maintain the benefits of direct interaction with therapists. And finally, I also would like to comment that we should consider not just the acute rehabilitation, but the maintenance rehabilitation and the exercise and the need for continuity of fitness exercising. And at least in Singapore, the Health Promotion Board has developed a series of videos and guides of how people can work at home, exercise at home safely. And they do take into consideration activities which are more suitable for older people and people with impairments. So I thought I'd just spend a few minutes sharing what our local stroke support organization has done. This is the website of the Singapore National Stroke Association, and we've now added to it new components since the COVID crisis. We have something called SNSA Live. This is on a Zoom platform, which is active, interactive, and participative. It may include group exercises, mindfulness training, some education, and sometimes just some chit-chatting. But in order to get people on board, we have instructions of how to use Zoom. Not everybody may be familiar with it, and also some security and precaution measures that are taken so people feel comfortable accessing these webinars. We also have many videos which are online, which you can be downloaded or be viewed on our website. They're short and sweet. The good thing is many of these exercises we think that our volunteer therapists had worked with our members before COVID during our group sessions, and they've now put this on video so they can continue doing it at home. And safety is very much a big part emphasized. We've also put in resources which are free and available, and I think we've also had, there'll be sharing of some other resources that people can use. And I think this is very important for us to not have to duplicate everything, but to work with others and use resources that are available, but make these accessible to our members. We've also had some of our own videos which we have made, which sometimes is also important to complement what is available online. So you have local context, familiar faces, and use of local languages. So we have a series for mindfulness, which includes some physical stretching exercises. We have some upcoming new events. We're doing one where we asked our members to share their artwork. So I think really this is where we can be open to new ideas and think about the resources and volunteers we have available to try and develop these new programs. I'd like to emphasize that we really should remember the interaction and peer support is really what people want. That's the feedback we got from our members at SNSA. So we do need to listen and get feedback so that we can develop the program in accordance to what our members want. I just wanted to end with a few general comments about rehabilitation during this period. Rehabilitation, the spectrum is extremely wide. There's so many people involved, so we should work together. It's already very complex and survivors can feel very lost. So we shouldn't have many different ways of doing things. We should coordinate so we can optimize our resources and maximize the effect. Secondly, I think we should look at some of the opportunities to innovate and adapt during this unfortunate pandemic and challenge ourselves to find new opportunities to do things even better than before. And I put this picture up because I just saw it on Facebook that there's actually this mirror device which people are using for fitness. And can you imagine how great it would be if we could have stroke survivors having access to this kind of technology? I'd like to also have us all remember that there are different needs, different issues, and therefore different solutions for different people. There may be some who are not IT savvy and may need to have hard copy pictures of how to do the exercises at home. Some people may have limited internet availability and cannot participate in Zoom, and so we should have downloadable kind of videos. Some people may be shy and unfamiliar, or even for new stroke survivors, initially there may need to be some one-on-one sessions first. We allow all our SNSA members to switch off their camera should they be shy or feel that they are not in a suitable place to Zoom. And another problem which we have encountered is that there are stroke survivors out there who are becoming deconditioned as a result of lack of rehab. And so we really need to focus on how to identify these individuals early and set up good interim therapy programs for them. As mentioned earlier, I think interaction is very important. So it's not just all about exercise. We need to look at how we can get people to communicate via Zoom and other ways so that they feel that they are supported. finally, I think as Sharon mentioned, advocacy is very important. We had our also Stroke Don't Stay at Home video, which I've shown you a screenshot here. But I think when we have evidence and data from research, such as that survey that I showed you earlier, we were able to use that and send that into our Ministry of Health to lobby for the reopening of more rehabilitation facilities. And finally, I think this is a first step, in many, I hope, for us to work together, where we can potentially share our ideas and programs, collate resources which are free. We shouldn't duplicate our work. SNSA is very happy for anybody to come and look at our website and use the resources there, work together, pairing with SSOs and pairing with countries and having regional discussions. And I'm very happy for anybody who would like to contact me, and I've put my email down here, and be very happy to chat with you via email. So I thank you very much for the opportunity to share the experience from SNSA, and thank you very much to WSO for organizing this webinar.
Thank you so much. That's wonderful. The chairing of the webinar to Sharon McGowan, who from the Stroke Foundation. Hopefully, I'm just getting a message, my internet is unstable, hopefully it isn't. Sharon, if you'd be happy to take over now and manage the Q&A. So we've had quite a few questions come through, so it looks to be lively. And I'll pass the hosting over to you.
So thank you so much, Deirdre. You're obviously doing so many things. I'm busy writing down, thinking mindfulness sessions, art therapy, dance therapy. I think it's wonderful. I think that one of the things that we can definitely learn from this is, one is actually collaborating more across our organizations, but also really thinking about the innovations that have come from this time, and actually thinking how we can continue to use those in the future and continue to adapt and learn. So Emma, we do have some questions that have come up in the Q&A. So one of our attendees has asked specifically about what supports, groups and networks have helped you, your loved ones and friends during this time.
I think largely it's been through virtual Zoom. I've been previously quite active, and it's been amazing to have that virtual connection with people. As I live alone at home, it's quite isolating, and I think there's an overarching fear globally that whilst our voices will not be heard, and there will be an inability to advocate. And I think that's been quite scary, but it's amazing although I've been I guess unable to travel due to COVID, the opportunities and projects and connections that I've made in different groups, and even peer support globally, where I can contact other people who have gone through trauma to ensure that they don't feel so isolated. And definitely, Deirdre alluded to in that psychosocial, the huge anxiety that is so. I think even though I'm so physically affected from my stroke, it is that emotional, the anxiety and everything that I think it's more evident at this time, because all my coping mechanisms in being able to, I guess, use those as an outlet to help that emotional side of my recovery. Those strategies don't work in COVID. So I guess meeting people online has been the best way of dealing with that.
And you're certainly very active on social media as well, Emma. And one of the things I noticed on social media was how prevalent your beautiful dog is. So how important has having a pet and that sort of pet therapy been for you?
So amazing. Gilbert, my dog, has been an amazing sidekick through this time, and particularly when I'm previously been quite active, and I think I've realised I can't swim to manage my pain, I can't do a lot of things, so I think it's being proactive rather than reactive to that. So for me, I've been able to organise all those groups and do that and partake in that. And I think a lot of stroke survivors don't have that ability to connect, and they need help to facilitate that and fall through the gap. And I, at the moment, feel quite isolated and quite anxious about the future. And I have an amazing support network, and I've got a great setup. So I can't the impact that this would have on others. And so that for me fuels me to advocate more.
And certainly from our perspective, Emma, that's why you were the first kind of person I thought about to join us and share your experience, because you're so inspiring the way you share both the things that you're trying to do, the challenges that you have in such a public way over social media, to be a role model for others who are experiencing similar challenges during this time. Deirdre, we have a question for you. Sorry, Emma. We have a question. Thank you for sharing your knowledge and experience. What would you recommend us to start rehabilitation on COVID positive patients?
Well, COVID positive patients. So I think actually in the inpatient setting, there would be, obviously the need for a lot of protective equipment and such, and that may limit a certain extent accessibility, and there may be limitations in moving to common gyms, and maybe the rehab is done more in the individual patient room until the swabs are negative, for example. But we do know that there have been associations of stroke in COVID patients, and some of these have been particularly severe. So it's very important. There would, I would think, be a program within each hospital to continue that rehabilitation within the hospitals until the patient is completely clear in terms of infection control before going to common facilities in the outpatient setting. But I guess for those individuals, they're recovering not just from the effects of stroke, but often they would have had other disease systems affected, primarily respiratory, and some may have been in ICU or under ventilation. So they'd have to have a combination of both the usual stroke rehabilitation as well as that kind of post-ICU rehabilitation. So I don't think it's easy. At least in Singapore, we have not, we have seen some strokes associated with COVID, but it has not been that many as in some of the other countries around the world, thankfully. But it is an excellent question.
Okay, thank you so much, Deirdre. Now there's a question to all of our panel members relating to technology. I think there's been a common theme around all of our presentations today around the use of technology. So technology has played a significant role in stroke rehabilitation during the pandemic. So what do we see as the key opportunities or learnings from this experience that we can put into place beyond? So mentioning some of the items that you showed us, Deirdre, and some of the innovations that you shared, how you intend to use that in the future.
So I think we probably underutilized it pre-COVID and did not recognize the opportunity. And unfortunately, it took COVID for us to realize it. But it's got tremendous potential. I don't think we've maximized it yet. I think it also has potential for us to, as you mentioned, in large countries like Australia, where there might be people in rural areas, to reach out to them, but also across countries. Now I can talk to you as easily as I can talk to the person, who's next door to me. So I think, we need to look at the opportunities that we can leverage from technology beyond what we did. I think what we did initially was very adaptive, very knee-jerk. What can we do because we're in this situation? But now we need to think a little bit more tactically and how we can maximize it. But bearing that in mind, I'm also wary of some people who may not be so comfortable with technology, and how do we ensure that they are not excluded as we forge ahead with programs with using technology. So whether it's teaching people, hand-holding them as to how to get set up, and I'm sure once they get set up and familiar, they'll be fine. But for people, for example, with internet access problems, how do we ensure that they still are included and can feel supported with limited technology? And I guess the other thing that comes to mind is that while technology is great, the personal touch, the face-to-face interactions is something people also need. And so how do we balance having some of that and letting technology complement? But I do think we have a long ways to go in to try to maximize it and optimize it.
Thank you, Deirdre. Now we just have about 2 minutes to go. So Emma, from your perspective, thinking about the technology and what's happened over the last few months, what do you think would be the key thing that you would want to keep for the future?
Yeah, I think as Deirdre mentioned, definitely technology has really, really enabled, as I mentioned, me to connect with people globally, and it's been great. I do feel that there are also many who can't access technology, and that there needs to be, that's great to implement, and definitely something great that's come out of this. But there is many considerations that I think whatever means of support, it needs to be complemented by technology. I know for me, I was very savvy, I guess, with using technology, and was able to do that and use it a lot in all my activities early on, and realised that about 6 weeks into isolation that my eyes were suffering. So I couldn't screens as much. So I think the educational component of that too, that, you know, it's an avoidable aspect of using technology for stroke survivors, and the issue of the physical and emotional impact of that, and the ability for a stroke survivor to navigate, not even access, but to navigate it, can cause a lot of frustration, and doesn't replace that face-to-face need.
Very important points, and I think we feel very much the same. I think this is a huge opportunity to turbocharge telehealth, but it has to be seen in context. It's not the only pathway, and it's certainly not suitable for everyone. So it's about having it as a pathway for people where that actually is helpful to them, and particularly where people are regionally, rurally, or remote based, and it can actually prevent them doing, you know, 3, 4, 5 hour round trips to access care. So it's I think it has a huge opportunity. I did want to thank you all for presenting today, and particularly thanks to the World Stroke Organization for organising these webinars. I think it's an extraordinary opportunity for us to share our experiences, and I particularly wanted to thank you, Emma, for joining us today and really giving us that experience of what it is like, has been like, to be a stroke survivor and an inspiring role model to the stroke community during this time. It's been really wonderful, and I think just ending on that, we should all be thinking about unlocking possibilities is a great way to finish this webinar. So thank you all very much. I'll pass back to you, Carmen.
Thank you, Sharon. So I'll just pop up our final slide for today. So as we know, thank you so much to Emma, to Deirdre, to Sharon for the presentation. Congratulations to you all. Our webinar today, as you mentioned, Sharon, is brought to you by the World Stroke Organization, the World Stroke Academy, and of course, Stroke Connectors.